we're likely to see a spike in acute malnutrition in South Africa over the next few months. As incomes decline, household spending shifts from more nutritious foods like eggs and pilchards to cheaper starches, and children stop growing both physically and intellectually. We've calculated that providing sufficient food to a child aged 6 requires at least 570 Rand a month, while an adult's nutritional needs cost 730 Rand a month. But even some supplementation of household income may prevent that family from tipping over the edge into acute malnutrition. While government has now temporarily increased the childcare grant, there's still many poor families who don't receive any form of social assistance, and of course it's not available to children of foreign nationals. Pregnant women don't receive it either, and with the closure of Home Affairs offices, registration and access to grants for new mothers is further delayed. In some of the programs that we support, up to 40% of children do not receive the child support grant. So getting food to families at this time is critical, but the delivery of food is expensive, logistically complicated, and it creates risk, both for COVID transmission and for crowd control. Food vouchers make a lot more sense, but they can also damage the livelihoods of local shop owners if they're only redeemable at the large retailers. So what is required is a system of local identification of people who need the food most, with vouchers that can be redeemed at local spaza shops and general dealers. And ideally, those vouchers should be interoperable, in other words, redeemable at any store, most convenient to the recipient. Unfortunately, the big companies in South Africa have chosen to issue their own vouchers and ignored all pleas for interoperability. But there are over 220,000 spaza shops scattered across every village and town in South Africa. We at the DG Murray Trust have teamed up with two major technology partners, Flash and Kazang, that service these spaza shops. A network of NGOs across the country identify people most in need and register them locally so that a food voucher of 200 Rand can be sent to their cell phone number. If they don't have cell phones, and a surprisingly large number in rural areas don't, then a paper voucher is issued. Grow Great, a national campaign focused on nutrition, then sends messages to each recipient on the 10 best buys for that money, highly nutritious foods at lowest cost. The system works pretty well because we have trusted local NGO partners who know their communities and can assess real need. No system is fraud-proof, but this is a way of significantly reducing leakage and distribution costs. And local economies can be assisted to thrive. It's the type of system that government should adopt. For example, in Coffee Bay and in Mkanduli in the Eastern Cape, Pilani Health and Nutrition Mentor Mothers identified all the pregnant mothers in their community and registered them to receive vouchers. Grow Great did a similar thing in Nkomazi and in Mpumalanga, Giani, Mkhobeskloof, Greater Letaba in Limpopo. Despite the pitifully small amount that we could give to everyone, you should have seen the joy. And with more funding, we can easily repeat these contributions. We have their numbers. This is how we can protect our future, even as we confront the virus we face today. So thank you to the hundreds of individual people who've made contributions in response to COVID. In terms of the food vouchers, every cent raised goes to the families in need.